Texas Family Wellness Clinic with our friend Dr. Guevara for another health and wellness moment, and we're talking about something that you have heard at least once or a million times in your life: sleep apnea. I think many of us know somebody if we don't suffer from it ourselves, but what is it, how does it work, and how do we get relief or some sort of help if we do have sleep apnea? So I'm grateful to be here with you today.
Thank you, Clarissa. Thank you for being here. You're absolutely right. You probably do know somebody who has sleep apnea because it is very common. So it's estimated that about 100 million Americans suffer from obstructive sleep apnea, and only 30 million of them are being treated. So it is a big deal.
Okay,
sure.
And this is something that we sort of have to self-evaluate, or in many cases the spouse is the one noticing, because what kind of symptoms are we looking out for?
Right. So the main symptoms are going to be things like snoring. Your spouse or significant other may notice that you stop breathing while you're asleep at night. So that's what we call apnea.
Okay.
The person who has apnea may notice symptoms including things like daytime fatigue or sleepiness. They might notice headaches or brain fogginess, things like that. They might fall asleep while they're driving or watching TV or a ball game or a movie or something like that. So those are the main symptoms that people who have sleep apnea suffer from.
Okay, and if we do have sleep apnea, what is it scientifically, and is it related to any other health issues?
Absolutely. So the main problem is that when you stop breathing while you're asleep at night, your brain recognizes that it's not getting any oxygen, so it sends a panic signal to the rest of your body that you need to wake up. So you wake up multiple times during the night. In fact, I had one patient who woke up 88 times in one night during their sleep study.
Wow.
So it was like, someone waking them up every few minutes and not allowing them to get that deep sleep. So the next day they woke up and they wouldn't feel rested. They felt very tired and sleepy. But because of that, because your heart is strained so much overnight, it can cause other health problems like hypertension, which is a risk factor for things like strokes and heart attacks. So it is a big deal to get this evaluated and treated. So the main thing is to come in for an evaluation. We do a questionnaire, we examine you, we evaluate you. If we feel that that is a possibility, then we set you up to have what's called a sleep study, where generally you'll go and stay overnight at a sleep study facility. They will evaluate you by hooking you up to a bunch of monitors to evaluate your brain waves, your heart, your lungs, your muscles. They do all that. Of course, that's one treatment option. Other treatment options include some oral devices. Surgical intervention is also sometimes indicated or necessary. But the main gold standard is going to be the use of continuous positive airway pressure.
So are there any preventative measures we can take, or can it be reversed?
So occasionally can be reversed, not very common, but with enough weight loss. I've had a couple of patients who've been able to get off of CPAP therapy. Other things that can help: reduction in alcohol consumption, and of course smoking cessation.
Yep, all those obvious answers: diet, exercise, don't smoke, don't drink a whole lot. But you know what? It's all up to you. You have to make those decisions every day for your health, and one of those decisions is finding the proper medical care. And someone like Dr. Guevara and his team here at Texas Family Wellness Clinic are very thorough, as you may have learned if you see these segments regularly. They do take applications for new patients, so come visit them at their Southside location. You can get online and fill out that application and become one of their patients and take advantage of all the wonderful services they offer here at Texas Family Wellness Clinic. Thank you.
Yes, ma'am. Thank you.
Health and Wellness with Dr. Guevara is paid for by Texas Family Wellness Clinic.